Thank you for taking time today to learn about board certification through the American Board of Family Medicine. This is a process that you'll begin working on during residency, typically guided by your program director or faculty advisor. In this video, I hope to help you understand the broader picture of certification for family physicians. What is it? Why is it important? And what do you need to know as you move through residency and beyond? The American Board of Family Medicine, which was originally known as the American Board of Family Practice, was initially created over 50 years ago in 1969 after national reports identified the need for a healthcare delivery system that emphasized comprehensive, continuous primary care. The first group of board-certified family physicians came from 2,000 physicians who took their first examination, which included 1,350 questions over 2 days. To this point, your time has been spent in formal medical education, which includes medical school and residency training. Yet most of your professional career will take place after your formal training is completed. I'm sure you've already seen how quickly new medical knowledge emerges for both diagnosis and treatment. Have you considered yet how you're going to keep up with this knowledge after you finish residency? Your patients and your colleagues expect that you will consistently demonstrate current knowledge and skills as you provide care. Board certification plays a significant role in this regard. The goal of continuous board certification is to ensure that as family physicians, we're prepared to meet the National Academy of Medicine's 6 aims for healthcare by providing care that is safe, effective, patient-centered, timely, efficient, and equitable to all who seek our care. Certification is a credential above and beyond state licensure, with standards set by family physicians and for family physicians. Being certified demonstrates your commitment to an ongoing process of continuous self-assessment, improving care and practice, and delivering the best care possible to your patients and to your community. It also means that you're continuously meeting standards for ethical and professional behavior. We know that board certification is recognized by patients, the public, and many of our peers as a marker of a high-quality physician. In a national survey of patients, in fact, board certification was listed second only in importance to, is this physician in my network? Patients acknowledge that they do not know what we do to attain or maintain board certification, but they do believe in its importance. Studies by ABFM and other certifying boards have shown associations between board certification and how current one's knowledge is, as well as the quality of care that's delivered and the fact that fewer adverse medical license actions are taken against board-certified family physicians for professionalism reasons. These studies can be found on our website and at the American Board of Medical Specialties. But what really underlies the rationale for the design of board certification? A recent comprehensive review entitled Conceptual Foundations for Designing Continuing Certification Assessments for Physicians describes the foundational evidence underpinning the need for continuous certification. This report revealed 4 central themes. Number 1, cognitive skills need to be kept current. The evidence is clear that with the explosion of new clinical knowledge and approaches to care, coupled with natural declines that occur in cognitive skills over time, constant vigilance with lifelong learning is necessary for us to remain current and provide the highest quality of evidence-based care. Number 2, individual self-assessment is not enough. Continuing medical education is an important part of lifelong learning, but board certification provides something additive, an ongoing process of identifying our own knowledge gaps. Abundant evidence over many years has consistently demonstrated that as physicians, we simply don't know what we don't know. It's called the Dunning-Kruger effect. We also consistently overestimate how well we retain the information we learn. Therefore, we may not identify and close knowledge gaps just based on what we select for ourselves for continuing medical education. This is where ABFM self-assessment activities, such as knowledge self-assessments, the continuous knowledge self-assessment, and Journal Club, which I'll talk about later, provide a mechanism to do this so that we can address our knowledge deficits. Number 3, testing enhances learning and retention. While not popular, testing has been proven to be a powerful motivator for learning and retaining knowledge. In addition, testing also supports the application of complex problem solving and enhances retrieval of information from memory. What is new for board certification is the recognition that longitudinal assessment is actually better for retention of knowledge learned as compared to the rote memorization that often precedes the one-day examinations that we take, which tend to promote binge and purge type of learning. ABFM's new longitudinal assessment is an example of this, intended to support learning while testing. And number 4, goals and consequences motivate. Research has found that physicians learn and retain more when they know they'll be tested. The expectation that we'll be required to periodically demonstrate our cognitive expertise over the course of our career increases our motivation to study and update our knowledge competency over time. Patients expect this of us. And that really makes sense when you think about the fact that we want our airline pilots and our school teachers to also be periodically attested to ensure that they're keeping up with their knowledge before placing our lives or our children's education in their hands. There are 5 key steps involved in becoming board certified. Number 1, during residency, you will participate in activities that support self-assessment and performance improvement or quality improvement. These are the same types of activities that you'll continue to do on a regular basis throughout your career to remain certified. Number 2, you will also take and pass the initial certification exam. The good news is that over 98% of initial certifiers pass the exam on their first attempt, because this is the time of your career when you'll likely know the most about the greatest number of things. Number 3, you will need to obtain a current, valid, and unrestricted license to practice medicine in the U.S. and Canada in order to be considered board eligible and to become board certified. This is beyond the training license that you're practicing under now during your residency. This is also true even if you're pursuing additional training such as a fellowship, since being board certified is required to be able to take your subsequent exam for the specialty area in which you're completing training. Number 4, you must always comply with ABFM's guidelines for professionalism, licensure, and personal conduct, which we'll touch on later. And finally, you must complete all of your residency training requirements as defined by the American Council on Graduate Medical Education's specific requirements for family medicine. Your program director will be asked to verify that you've met your minimum continuity requirement and indicate that your residency faculty have concluded that you are ready for autonomous practice. When each of these 5 criteria are met, you'll be considered board certified. If you do 4 of them, but choose to take your exam later, you'll still be able to qualify as board eligible for the first 7 years. These steps to become certified by ABFM are the same for both MD and DO graduates of ACGME accredited residency programs. Most residents take their initial certification exam in April of their PGY3 year. However, some elect to complete this part of their certification requirements later after training. Any new graduate has up to 7 years after the day they complete residency to qualify to take the examination and represent themselves as board eligible. If you complete the exam requirement within your 3 years of finishing training, the activities that you did in residency will still count toward your requirements, and you can simply take your examination. If it is longer than 3 years before you decide to take the certification exam, you'll need to complete the requirements for CME, self-assessment, and performance improvement activities again before being registered to take the exam. You can think of certification as involving 4 components, each with a different purpose. After you become certified, you'll enter what is referred to as the continuous certification process, which consists of activities such as self-assessment and performance improvement that you'll do in stages. For your subsequent examinations, you'll choose from either the longitudinal assessment or the one-day exam in the year in which you're due to take your next examination. Additionally, you must always comply with ABFM guidelines for professionalism, licensure, and personal conduct. We'll talk about these in more detail in the coming slides. ABFM has a variety of options for you to choose from based on your interest or your own learning style to accomplish regular assessment of your own knowledge competency. You can mix and match using different activities to meet your requirements. For these activities, you're encouraged not to look up the answers, but simply to answer with what you believe is the correct answer, and then use the critiques and references for the topic areas to identify where your knowledge gaps exist. Knowledge self-assessment, or KSAs, includes 60 topic-specific questions that are intended to help you take a deep dive into a clinical area relevant to family medicine practice. Each question represents common clinical scenarios. You'll complete all of the questions, and then you'll get to see how you did. You'll be able to review those critiques and identify references that you may wish to read in the future. Ultimately, you'll need to answer 80% of questions correctly to obtain credit, but you have as many attempts to accomplish this as you need. You can complete as many of the KSAs as you want just for your own learning and exam preparation, even after you've met the minimum requirement. Continuous Knowledge Self-Assessment, or CKSA, has become one of the most popular self-assessment activities. CKSA provides you with 25 questions each quarter and includes a variety of topics that cover the breadth of family medicine. And just as with KSAs, you'll receive a critique and references that explain why the correct answer was correct and why the other options were incorrect. This time, you get the critique and references after you answer each individual question, and there's no minimum number of correct items needed to receive credit for CKSA. You may use resources along the way as you complete your CKSA, but since this activity is intended to help you identify your knowledge gaps, you might consider trying it without using references. This way, you can take maximal advantage of the individualized performance report that's provided for your self-improvement efforts. This estimates your likelihood of passing the one-day exam, but it's only valid if you don't use references while you're doing it. CKSA also has a mobile app that's extremely popular, allowing for incremental engagement with questions as you go, whether you're in the grocery line or during TV commercials or waiting for your next patient. The ABFM National Journal Club has recently been added to help family physicians keep up with important, relevant, practice-changing articles, while also receiving certification credit in the self-assessment category. Articles are curated by a national panel of family physicians whose goal is to identify the most important articles published in over 100 journals on the basis of impact on practice, relevance to family medicine, and methodologic rigor. From these, you can choose as few or as many as you wish to read. Articles are selected twice a year to provide the most important new evidence that we need to know as family physicians. Each article requires you to answer 4 questions, and just as with KSA and CKSA, provide you with certification and CME credit. In addition to these options, we have more self-assessment activities that may be completed for credit towards stage requirements. Many of these are linked to other specialty boards activities, such as pediatrics and emergency medicine, in order to support maintenance of a broad scope of practice or to support those in alternative practice models. Also included is a set of excellent modules on health equity offered by the American Academy of Family Physicians, as well as the AAFP's Also Provider Recertification course. This is not the Also course you take during residency, but any that you take subsequent to that. All of these activities allow you to earn self-assessment credit for board certification. While continuing medical education credits do not impact you during residency, they will play an important role in continuous certification, where you will need an average of 50 CME credit hours per year to maintain your ABFM certification. ABFM allows you to count the same activities that you do for your state medical license board and/or your American Academy of Family Physicians membership. If you are an AAFP member, you simply report your CME in your AAFP record, and that information will seamlessly transfer over to your ABFM portfolio. If you do not utilize the AAFP CME reporting system, you'll still be able to manually enter this information into your My ABFM portfolio. The goal of including performance improvement as a component of certification is so that we, as board-certified family physicians, can demonstrate that we know how to reflectively look at our own practice, identify a gap in care delivery or outcomes, put something into place to try to close those gaps, and then remeasure to see if what we did resulted in an improvement. Improving care and practice is something that any clinically active physician can do, whether or not you have a continuity panel of patients or not. A wide variety of performance improvement activities are available for you to choose from. There are ways for hospitalists, those in urgent or emergent care settings, providing palliative care, or sports medicine settings, and even those doing locums, to make improvements in how care is delivered and submit those to ABFM for credit. To help you narrow down a list that's more relevant to you and your practice, we encourage you to complete the Activity Preferences tool in your My ABFM portfolio. It's important for you to note that ABFM is not asking you to do something extra just for certification. Most family physicians are continually improving care in their practice today. This is why we developed the self-directed performance improvement activity, which allows you and up to 10 physicians working together on a single performance improvement activity to simply report on what you're already doing and to be able to receive certification credit for that. The self-directed activity is also a good choice for physicians in non-traditional practices who may not find a relevant ABFM-designed performance improvement activity to meet their needs. Additionally, if you have an idea of something you want to improve in your practice, but it's not included in the ABFM topic-specific list, you can use the self-directed activity to report this for credit. Now, let's talk about your initial certification examination. ABFM provides you with an opportunity each year of residency to see how you're performing related to other residents at your same level of training, and to see how you're progressing year by year. This is done through the in-training examination, which mirrors the examination you'll take to become certified. You and your program director will receive these results, which will tell you how you're doing compared to both your peers locally and nationally. It will also identify areas for you to focus on in your training and through your independent study. It will predict how you'll perform on your certification exam if you were taking it that day. Residency programs also use aggregate data from in-training exam results to identify areas within their curriculum that may need strengthening. When it's time to take your initial certification exam, this will be scheduled through your registration with ABFM to occur on a specific date in a secure test center, much like you've done for USMLE exams. The exam consists of 300 questions that are delivered in 4 sections of 75 items each, with opportunities for breaks in between. It's really important for you to read the details in the candidate information book when you register for the exam, so you'll know what is required of you by ABFM and by the test center, and so that you can understand the opportunities for learning more about the process before the day of your exam. In 2019, ABFM launched an alternative to the one-day examination called FMCLA, which stands for Family Medicine Certification Longitudinal Assessment. You'll be able to utilize FMCLA to meet your exam requirement in the future. This involves completing 25 online questions each quarter at the location of your own choice, on your own time schedule, and at your own pace. In FMCLA, you can use references as needed, just as you would in practice. Questions are timed at 5 minutes per question to allow for lookup as needed. FMCLA requires that you complete 300 questions, just like the one-day exam for scoring. So it takes a minimum of 3 years to complete, and you have up to 4 years to do so. FMCLA also provides the flexibility for you to take breaks as needed or desired, as long as you've completed 300 questions by the end of that 4th year of participation. Unlike the one-day exam, with FMCLA, you'll have the opportunity to learn right away if your answer is correct or incorrect, and you'll receive a critique instead of references to explain why. If you choose to stop participation in FMCLA at any point, or you're unsuccessful at the completion of the exam, you will not lose certification immediately, but will have 1 full year to take and pass the one-day exam after that. Professionalism is at the foundation of medicine's social contract with society. For the privilege of self-regulation and autonomy, society expects us to place the interest of patients above our own, to maintain standards of competence and integrity, and consistently demonstrate trustworthiness with patients, colleagues, coworkers, and the public. For this reason, professionalism has always been a component of ABFM certification. Professionalism is also a major part of medical licensure. It's the role of individual medical license boards to assess and to address, through specific licensure limitations or revocation, any behaviors considered to create potential safety concerns for patients and the public. The role of certifying boards is different, We do not tell physicians what they can and cannot do, but we do evaluate sanctions by medical license boards or other breaches of professional norms to determine if the behaviors are inconsistent with being recognized as a board-certified physician. The Professionalism Committee of the ABFM Board of Directors uses a three-part framework to evaluate each case of reported professionalism breaches and to make a determination about board certification status. They ask three questions. Was the care that was provided safe? Did the physician behave in a manner that was honest, ethical, and trustworthy to patients, colleagues, coworkers, and the public? And did the physician practice at the level expected of a board-certified physician? Acting on issues that are serious breaches of professionalism is important for our patients, the public, our specialty, and the self-regulation required of us as medical professionals. Thankfully, professionalism violations and loss of certification are not common at all among family physicians. It only happens in 0.09% of all diplomates or certification-eligible physicians. And more than half of those who do show a break in certification for professionalism reasons are able to have their certification restored when their license is reinstated or the limitations on their license are removed. It's important to make time now to read the ABFM guidelines for professionalism, licensure, and personal conduct, to become familiar with the descriptions of those behaviors and actions that would result in potential loss of certification. You won't be surprised by the most common reasons for loss of a medical license or restrictions on a medical license and the subsequent loss of certification. These are dangerous or inappropriate controlled substance prescribing, sexual boundary violations with patients, and personal alcohol or substance use disorder. It's important to know that participation in physician health plan programs, when voluntarily seeking help for issues like substance abuse or mental health issues, do not automatically result in loss of certification if the state license board does not apply sanctions against the physicians. Additionally, if you ever falsify or fail to submit any prior professionalism concerns during your training, any prior medical license sanctions, even on your training license, or any prior convictions, misdemeanor or otherwise, on your license or credentialing applications, or if you misrepresent your ABFM status, for example, saying you're ABFM certified when you're not, or if you've discovered to have cheated on an ABFM examination, any of these will cause violations of ABFM guidelines, and it may affect your board certification status. If you ever wish to consult with ABFM to determine if a state license sanction might violate ABFM guidelines before you sign a consent agreement with the medical board, we're happy to advise about that situation. In addition to learning how to become a clinically competent physician, residency is a good time to focus on continued development of your professional behavior and to prepare for personal and practice behaviors that will keep you in good standing with your state medical license board and your board certification. These include further developing your interpersonal skills with patients, their family members, your coworkers and colleagues, understanding how to best respond to patient complaints, some of which may feel very personal, learning how to optimally use chaperones during patient visits, and what to avoid saying or doing with patients that may cross a boundary that is unprofessional, learning best practices for opioid and other controlled substance prescribing, and understanding how to interact with your medical license board when approached about a potential concern. We consider your investment in certification in two ways: the financial investment you make in maintaining your certification and the time you spend engaging in the activities to do so. ABFM has not increased fees for board certification in more than 15 years, despite adding a number of new activities and improvements to the certification process. In fact, 10 years ago, our board of directors voted to reduce annual fees from $235 to $200 per year, which covers the cost of all certification activities. Just this year, our board of directors approved additional steps to reduce cost of certification. Most notably for you, they voted to waive the initial $200 fee for continuous certification that you normally would pay in your first year after becoming certified. They also eliminated the $250 exam application fee that a physician pays every 10 years for their recertification exam. They are allowing for one free retake for any physician who's had an unsuccessful examination attempt, and they've reduced the cost of subsequent retakes by 50%. A new family leave or time away from residency policy was implemented July 1, 2020. This policy specifically sets parameters of the allowable time you have to be out of your residency without having to extend training and still become board eligible. Now, this policy does not override local program and institutional policies for time away, but it was designed to be more family-friendly than our previous policy by allowing a more appropriate period of time for major life changes, such as welcoming a new family member for both birth and non-birth parents, as well as adoptive and foster parents, or caring for an ill family member, such as a parent at the end of life, or for time you might need for a substantial health issue that requires longer periods of time for treatment. This policy does not, however, include periods of time taken away from residency for remediation or professionalism issues, which would require extensions of training. You can see the parameters for family leave here. It includes up to 8 weeks in a given academic year, which could be extended to 12 weeks if your institution allows through the use of your regular vacation or sick time. It also allows for up to a maximum of 20 weeks away over the course of your 3-year program, so that normal vacation and sick leave time is preserved in other years. Within a given training year, the requirements to spend a minimum of 40 weeks in your continuity practice remains, as does the requirement to have at least 1,000 hours of continuity time during your training, which is described in the new ACGME residency guidelines, before you can be considered board eligible. All of this information and more can be found on the ABFM website at www.theabfm.org. Just go to the Become Certified section and look for specific information you need. You can also find resource materials to download, like this one on requirements for training and licensure to become certified. The My ABFM portfolio is your go-to tool to help you track your progress with continuous certification, lifelong learning, and professional development in family medicine. Using your personalized dashboard, you can see at a glance your certification activity progress and any remaining requirements that you have. As mentioned before, be sure to set up your activity preferences so that your choices are more tailored to your interest and your practice type and scope. In addition to setting training standards for becoming board certified and providing a program of activities for continuous certification, ABFM also has a robust research department that focuses on understanding the value of certification and if the activities and processes that you do result in better care and outcomes. They also look at the ecology of family medicine over time, such as how much the scope of practice is changing among family physicians, and what changes are occurring in practice settings or organization. You play a significant role in how we're able to obtain data that describes this information, from training throughout the life cycle of a family physician. This data is critical for the specialty to understand. It helps both in advocacy and to inform major family medicine organizations, as well as over 700 residency training programs as they evolve and grow to meet the needs of the future. As an example, each year ABFM researchers analyze data from residents and early career physicians to produce reports for residency programs, state AAFP chapters, and others that describe the patterns of training in family medicine residencies and what happens after those physicians when they're in practice, relative to what they intended to do when they completed residency. Conducted through the National Graduate Survey, this information allows residency programs to assess their own strengths and needs, and is used in advocacy to support broader scope of practice and to understand where and in what settings family physicians are practicing. In this chart, you see how residents remain broadly trained and intend to practice broadly in training, but end up practicing more narrowly. It's a trend that has mirrored the decline in independent practice and the rise in the employment model. Our ABFM researchers also link to national data sets to demonstrate the value and power of the core tenets of family medicine, such as continuity and comprehensiveness. As you see in this chart, each of these contribute to lowering overall cost and reducing the risk of hospitalizations in patients cared for by family physicians. ABFM's vision as an organization is no different than your vision as a family medicine resident. Optimal health and health care for all people and communities that we serve. We hope that becoming a family physician will be one of the most rewarding aspects of your life and your career. We at ABFM are here to support you in any way that we can during your residency and at any point in your professional life after your formal training. Don't hesitate to contact us through our support center or through your My ABFM portfolio so we can help you meet your needs. Thank you for the time you've invested in listening to this presentation, and best wishes for a long, happy, and successful career.